Welcome to Mind and Body Health, your trusted source for health information. Today, we're diving into an important topic that many women are curious about but might feel hesitant to discuss: vaginal discharge. Vaginal discharge is a normal part of the female reproductive system, but understanding the different colors and what they indicate can be crucial for maintaining your health. In this video, we'll explain the various colors of vaginal discharge, from normal to abnormal, and what they can signify about your overall health. We'll break down each type, from clear and white to yellow, green, brown, and more, to help you identify what's normal and when it might be time to see a healthcare provider. So, stay tuned as we guide you through this essential aspect of women's health. By the end of this video, you'll have a better understanding of your body and be empowered to take charge of your health. Let's get started. Don't forget to subscribe for more informative videos on women's health and wellness. Vaginal discharge is a clear or whitish fluid that comes out of your vagina. Discharge is normal, but changes in the amount, consistency, color or smell could indicate an infection or other problem. Vaginal discharge is a clear, white or off-white fluid that comes out of your vagina. Your uterus, cervix and vagina produce vaginal discharge, which is mainly made up of cells and bacteria. It helps clean and lubricate your vagina, and helps fight off bad bacteria and infection. Discharge from your vagina is a natural and normal process, but changes to your discharge can be a sign of infection or disease. Women or people assigned female at birth, AFAB, have varying amounts of vaginal discharge. Some people produce more discharge than others, while others notice very little. Changes in the color, texture, smell or amount of your usual vaginal discharge may mean there is a problem. Most causes of abnormal vaginal discharge are treatable with medication. Normal vaginal discharge should be clear or white. It shouldn't smell bad, and its thickness may change throughout your menstrual cycle. Other characteristics of vaginal discharge include: 1. Texture. It's normal to have vaginal discharge that ranges from watery and sticky to gooey, thick and pasty. Your body's hormones cause this change to happen, but factors like infection can also change the consistency of your vaginal discharge. Vaginal discharge that is chunky, foamy or accompanied by itching and changes in color may mean you have an infection. 2. Color. Vaginal discharge is healthy if it's clear, milky white or off-white. Dark yellow, brown, green or gray discharge may indicate an infection or other issue. 3. Smell. Vaginal discharge may have an odor, but it shouldn't be strong and shouldn't be unpleasant. If you notice a fishy or foul smell to your discharge and it's accompanied by changes in texture or color, you may have a vaginal infection. 4. Amount. Some people produce lots of vaginal discharge, while others produce less. Certain factors like pregnancy, using birth control pills or ovulation can affect how much vaginal discharge you have. Sudden changes in the amount of vaginal discharge you produce could mean something is wrong. Contact your healthcare provider if you notice an increase in the amount of vaginal discharge, a change in the color of the discharge, a foul-smelling odor, a change in texture or consistency of the discharge, irritation, itching or pain in or around your vagina. The color of your vaginal discharge can mean there's a problem. If it's yellow, gray or green, yellow, gray or green discharge may suggest a bacterial or sexually transmitted infection, STI. If it's brown or red discharge is usually related to irregular menstruation or pregnancy, implantation, bleeding. If you have brown or red tinged discharge and it's not your period, it may indicate a problem. If it's clear or white, normal vaginal discharge is clear, white or off-white. If your discharge is white, but seems thicker than usual or causes itching, it may be a yeast infection. Contact your healthcare provider if your vaginal discharge changes color or texture or is accompanied by other symptoms like foul odor, itching or burning. It's best to get an exam to check for infection. Your discharge might change color, become heavier or smell different. You might notice irritation around the opening of the vagina. You might also notice changes before or after your period. Changes in vaginal discharge may or may not be a sign that you have a vaginal infection. If you're unsure, it's best to contact your healthcare provider. It's possible to have 2 or 3 types of infection at the same time. There are a number of infections that cause vaginal discharge to change or become unpleasant smelling. Many of these infections can be caused by having sex with someone who has the infection. The types of infections that causes vaginal discharge to change as follows. 1. Yeast infection. Vaginal yeast infections happen when a specific fungus, Candida, grows out of control in your vagina. It produces a thick, white, cottage cheese-like vaginal discharge. Your vagina may swell and be itchy, and sex may be painful. Antifungal medications treat a yeast infection. 2. Trichomoniasis or trich. Trichomoniasis is a sexually transmitted infection, STI, you get from having sex with an infected person. A parasite causes trichomoniasis. It makes your vaginal discharge green, yellow or gray and bubbly or frothy. It's treated with antibiotics. 3. Bacterial vaginosis or BV. Bacterial vaginosis occurs when there's too much of a certain bacteria in your vagina. It can be transmitted through sexual contact but not always. People with BV have white or gray discharge that's foul-smelling and fishy. It's treated with antibiotics. 4. Gonorrhea, CLAP, and chlamydia. Chlamydia and gonorrhea are 2 common STIs you can get from having sex with an infected person. Both infections are treated with antibiotics from your healthcare provider. Some people with these infections have cloudy, yellow or green vaginal discharge. If left untreated, the infection may spread, causing pelvic inflammatory disease with pelvic pain. Vaginal discharge is not always caused by an infection. Changes in the normal balance of healthy bacteria in your vagina and sexual excitement can also cause vaginal discharge. Other things that can cause discharge include 1. An object in or near the vagina that shouldn't be there. For example, you may leave a tampon inside your vagina. 2. An irritation or rash from something, an object or chemical, that causes an allergic reaction. This could be from detergents, soaps, sexual lubricants or materials used in condoms or sex toys. 3. A condition called atrophic vaginitis. This can happen after menopause when there is a decrease in estrogen. The lower levels of estrogen cause the walls of the vagina to become dry and thinner than normal. During pregnancy, you produce more discharge because it helps protect you from infection. Your discharge may become extra slippery and wet during ovulation, when your ovaries release an egg. This is to help sperm swim up to reach an egg for fertilization. It's normal to have some amount of discharge every day. You can't prevent it because it's your body's way of keeping your vagina clean and healthy. If you're worried about too much discharge, wear a panty liner to help absorb the fluid. It's normal to see an increase in the amount of vaginal discharge during pregnancy. This is to prevent infections from traveling up into your uterus. Increased levels of progesterone can also make you produce more discharge. You should contact your pregnancy care provider if you notice changes in vaginal discharge during pregnancy. There could be several reasons your vaginal discharge smells. If you notice an unpleasant or strong, fishy odor to your vaginal discharge, it could be a sign of an infection. Healthcare providers do not yet know all of the reasons why people get vaginal infections. They do know that some types are spread by having sex with an infected person. You might have a higher risk of getting infections if you 1. Have sex without protection or with many partners. 2. Have untreated or undertreated diabetes. 3. Take birth control pills or if you're taking antibiotic medicine. 4. If you have an HIV infection or have a decreased immunity. 5. If you use certain soaps, sprays or detergents. Your vaginal discharge might be a sign of an infection if it causes itching, causes swelling, has a bad or fishy smelling odor, is green, yellow or gray, looks like cottage cheese or pus, causes pelvic pain or pain when you pee. to keep your vagina clean and smelling good. Using mild soap and water to gently clean your vulvar area once daily should be enough to keep your vagina clean. Your vagina naturally keeps itself clean with the help of certain healthy bacteria. These bacteria keep your vagina acidic, which prevents microorganisms and fungus from growing out of control. Other tips for keeping your vagina clean include: avoid using perfumed soaps, gels, wipes or other feminine products. Don't douche or wash inside your vagina. Avoid wearing tight underwear, leotards, bathing suits or sweaty clothes for long periods of time. Wipe your vagina from front to back. This prevents bacteria from your rectum from getting into your vagina. You should see your healthcare provider if your vaginal discharge changes color, becomes heavier or smells different, or if you notice itching, burning, swelling or soreness around your vagina, or if you develop pelvic pain. Now let's talk about 4 home remedies for discharge, for yeast infections, BV and more. These home remedies are aimed at restoring normal vaginal flora levels and helping to reduce symptoms of conditions like yeast infections, bacterial vaginosis, and trichomoniasis. Condoms should also be used during sexual intercourse while completing any home treatment for vaginal discharge. Discharge that persists for over 3 days or is accompanied by intense burning, itching or pain should be assessed by your doctor. Keep in mind that you should speak to your doctor first before using these home remedies. 1. Guava tea. Guava leaves, known scientifically as Psyllium guayaba L, are a great home remedy to stop yellow-greenish vaginal discharge with a bad odor, or milky white, cottage cheese-like discharge. The ingredients you need to prepare this are 30 guava leaves and 1 liter, about 33 ounces, of water. How to prepare: heat the water up until it boils, then turn off the stove. Add the leaves and allow to soak for 3 to 5 minutes. Then strain and take a sitz bath with this tea, carefully washing all the genital area. Repeat this procedure 2 to 3 times a day. A guava leaf sitz bath is effective in treating vaginal discharge caused by trichomoniasis, which causes bacterial infections, and candidiasis cells that causes yeast infections. This home remedy is safe and does not have any associated side effects. Learn more about what causes yeast infections and how they can be treated. 2. Guava and sweet broom tea. Ingredients you need to prepare this are 1 handful of guava leaves, 1 handful of sweet broom leaves, 2 glasses of water. How to prepare: place the guava and sweet broom leaves in a bowl and add boiling water. Cover and allow to soak until the water is cool, then strain. Complete your usual hygiene routine and, when you are finished, wash the area with the infusion for a few minutes. Dry off with a soft, clean towel. You should repeat this every day for 1 week, before going to bed. 3. Garlic tea. Garlic has excellent antibacterial, antifungal, and antiviral properties that can be used to treat yeast infections and bacterial vaginosis. Ingredients you need for this are 1 clove of garlic, 1 cup of boiling water. How to prepare: smash or dice the garlic and add to the boiling water. Boil for 5 to 10 minutes. Then remove from heat and drink it, while warm, twice a day. To improve the taste, you can add grated ginger, lemon drops or 1 teaspoon of honey. 4. Tea tree oil. Tea tree oil contains antibacterial and antifungal properties that can be used to treat bacterial vaginitis, trichomoniasis and yeast infections. How to use: to use tea tree oil, mix 5 to 10 drops with sweet almond or coconut oil. Soak a baby wipe or piece of gauze in this mixture and apply to the external vagina. This can be used to relieve symptoms. The sitz bath along with a healthy diet can help in the treatment of vaginal discharge. You should avoid processed foods as much as possible and eat foods such as fruits, vegetables, natural yogurt, chicory, cabbage, lemon, melon or pomegranate, for example. These types of foods alter the pH level in your blood and genital area, promoting the restoration of normal vaginal flora. However, if the discharge continues for more than 3 days, even with home treatments, A medical assessment is recommended. Thank you for watching. We hope this video has provided valuable insights into managing vagina issues and natural remedies. Don't forget to like, subscribe, and hit the notification bell for more health tips and information. If you have any questions or topics you'd like us to cover, leave them in the comments below. Stay healthy and see you next time.